Finding the Voices
talk show by Monica Iguodam.
I'm a huge fan of Finding the Voice.
You're doing a great job for Manipur.
Manipur bu prithivida masatak pa
good positive voices and make those voices more visible.
We wanted our voice to reach in all the corners of the world.
Interesting people.
Been finding voices on
people from our own place.
Share positive stories and inspiring stories and bring out the good stories of Manipur.
Finding the Voices.
So moving on, just on a general level, just wanted you to share about challenges you have faced and how you have overcome.
Challenges,
particularly
yes.
Working, in the scenario of Manipur.
I would call them opportunities rather than challenges or obstacles. I would call them opportunities, because if they were not there, then I would have had no reason to overcome them and solve those situations. If you take on a professional level, when we started keyhole surgery, then it was not there in Manipur. And it was very difficult for people to accept the concept as well as the safety of that procedure and the benefits of that procedure. So it was a challenge, or rather an opportunity, I would say, that we had to build ourselves such that people would be convinced not by the way we tell them, but by the work that we do. So it was good. Because of that, we were able to get out of that stranglehold. People some of them used to simply come and say that we don't believe you. So, I mean, it was there in the beginning. Even the doctors, who many of them knew about laparoscopic surgery and keyhole surgery and the benefit, still they would not opt for or advise patients. So it was good that we were able to. Now it has become very popular, and everybody understands the benefits of laparoscopic surgery and keyhole surgery and endoscopic surgery. So it is there, very much ingrained now in the surgical fraternity. So that is one example I would cite for. Yes, being in Manipur and the socio-political situation, to bring in facilities of healthcare is not easy. It's not easy because we had situations where there was nearly 3 months of blockade. There was no way we could get oxygen into Imphal because at that time there was no factory in Imphal which was manufacturing medical grade oxygen, and all the roads were blocked. For 3 months, if the oxygen supply to the medical institutions, hospitals are not there, you can imagine what the situation is. We had a tough time then. We had to arrange so many ways, the different routes, and our own vehicle, we used the ambulance to ferry this oxygen cylinders, going through circuitous routes all across the state and this thing. The driver, our handyman, our technician, they were manhandled, and I mean, it was dreadful days. So that has given us an opportunity that why don't we have oxygen generated in Manipur, Imphal itself, and then we don't have to worry when there's a blockade or a band like that. So we approached to the government, and they have been very generous to grant us fund so that we could set up an oxygen manufacturing unit on a PPP model. We provided the land, they provided the infrastructure, and it is not yet commissioned because we are still waiting for a part of the sanction to come, and we will install the instruments and then we'll start. But if that happens, then definitely we will not be suffering those. So here was a situation where transport of oxygen, which is very basic, we can't imagine half an hour of no oxygen in the hospital, because there are so many patients who are continuously using oxygen on their ventilators and other instruments. So because of that blockade, because of the difficulties, we were able to then generate the idea and impress the government, and then we are now going forward to.
So for all the challenges, like there has been some opportunities coming out, or some solutions which has moved a step forward.
Exactly. So when we started, it was very small. We started with a 9-bed unit, Shija clinic that in Rims Road, and then again when we started doing more of laparoscopic surgery, keyhole surgery, we needed some expansion. So we increased it to 35 beds and took nearby buildings and tried to manage there, but it was not possible because the traffic congestion, the patients who have been operated and lying in the post-op ward was very next to the main Rims Road, and the honking and the noise and everything would disturb these patients. Water tankers which come to deliver water to our water supply, they would be threatened by the local people because they are blocking the road, and so many hassles. Because of that, we had to decide to move our facility here in with a larger area and larger hospital building, and we didn't have a ramp there because it was a pre-constructed, and it was very difficult to carry the patients after operation on the stretcher up and down the stairs to different rooms. So that has made us to make a hospital with a good ramp so that patients don't suffer that. Even when there is no electricity, when the lift is not working, all those things we were able to solve by that. So those were the opportunities that was driven to us by the need, and this is the facility, that the solution that we have come up with.
Yes, last time when I came, I got the opportunity to have a tour, and I was really impressed with the infrastructure.
So that is how I would say that bits and pieces of obstacles and obstructions and challenges we have converted to opportunities, and then try to
it's progressing. But I think the only the road to here, I think that could be improved.
Of course, that is not
I
in our hands.
know that is not in your control, but
that is not in our hands. But again, we are really thankful to the people and the society in Manipur. Even with this road, even with this situation, people come here because they have faith in us, or they trust us for whatever that we are doing. So, in fact, this is my I wouldn't say sermon, but knowledge sharing to my staff, subordinate staff, everybody, that you should treat each and every patient such that you should show them gratefulness that even in this road, in this situation, they are coming here. This is the last on this stretch. So they have come across all the other hospitals, including private and government hospitals, and they have reached here. So there must be some reason why they have come here. So you should acknowledge that and be thankful to them, because if the patients don't come, then we don't have work.
Right. So I have seen a lot of very good appreciation and feedback from people all over, and I myself, have been admitted in Caesar as a patient. My family members have, and we have always had very great experience. But at the same time, I have also seen comments and feedback about Shija Hospital being very expensive. What is your comment on that? I haven't really compared, the cost here and outside, but there has been some comments on that.
Yeah. From the beginning, we have tried to keep standards. And standards are some things which are, we are ISO recognized hospital, now going on for that NABH accreditation, which is for the hospitals alone. There's a national board of healthcare and hospitals and healthcare services. There's a national board. So we are in the process of getting that NABH. To keep standards, we have to do very many things which may seem not necessary, but to a lay person who does not know, but it is required. So in the process, definitely the expenses are more. And the cost of everything is much more to us. For instance, let me explain. The oxygen that we buy here now costs 4 to 5 times more than what it costs in the factory in Assam, in Guwahati. It costs around 300 over there. A giant cylinder of oxygen costs 300 over there. Here we were at a time buying something 1,200, and now it is less to around 900, 800 to 900, like that, one giant cylinder. So when we charge the patient on oxygen,
there will be a huge difference in the price.
Difference in the price, which we are not getting from anywhere other than the patient. And the patient feels the crunch, definitely. And since we are having the maximum number of critical care beds and facilities, so many of the patients who come here are using oxygen, and definitely that will come with a charge. Since I am not pointing out against anybody else, but as the others don't have that number of critical beds, they are not using that much oxygen as we are. The hospital who is using maximum oxygen as of now
in Manipur.
In Manipur. So oxygen alone costs more. If you see the cost from 300 to 900 or 1,200, the difference, that is only one item.
Right, and then there are so many other things.
So many other items there. So that is one difference, I would say. Another thing is, while trying to give that quality care, for instance, we try to prevent hospital-based infection, hospital spread of infection to the patient, to our patients. So for that, we advise that every patient should use hand rub. The staff, the doctors, the patient relatives should use hand rub every time they touch the patient, so that they themselves don't give any infection to the patient and they don't carry infection from the patient to them. So we issue hand rub bottle, 100 ml hand rub bottle to every patient. To some patient, it appears to be unnecessary.
Right. But there is a reason. And
there is a reason behind
it.
it.
And it's that the ISO and process and control, that's where it's coming.
It's coming. Now, the benefit part they don't see. Because of that, what we have achieved is that for some surgeries which are clean, we can do away with only one prophylactic antibiotic injection. Suppose a patient comes with gallbladder stones and there's no infection as such. Operation is required. What I do is I just give one injection just before the operation just give one injection of antibiotic, and after that no more antibiotic, even when the patient goes home. Only when the patient requires, for particular reasons, patient is diabetic or already infected, then we prescribe more antibiotic. Now, that has done good to the patient to avoid cost of that antibiotic, and also that we are not developing bacteria which are resistant to a lot of antibiotics. The hospital is attempting to create such a situation by our infection control program. That benefit is not visible to the patient and patient relatives. That is the reason why they think that it is so. It is ultimately, it will go in the long term basis, it will be good. It will do good to the community, that we are not creating bacteria which are resistant to most of the antibiotics in the community and such things. That's how we are attempting to go forward. But that would seem as an extra cost to the patient.
To the others.
Yeah.
But at the same time, just to note, you know, for people going outside, yes, maybe the cost in the hospital may be less, but there are the additional costs of travel, staying, and things like that. So if we have the facility over here, and hopefully with time, with our own infrastructure, you know, things may become cheaper and the cost may come into control.
Actually, that is easy to understand for the people, that the cost of treatment here will be much less than going out. And once if somebody experiences that, they immediately know the difference and they are ready to accept it as well. But the cost of treatment, again, as compared to the other hospitals or other institutes within Manipur, that is where the patients think that Shija Hospitals is costlier. So
okay, so the comparison is not so much against Shija and the other hospital outside of Manipur, but it's within the hospitals.
If somebody really does that, then they will all find that the Shija Hospital is much less. It's much cheaper than hospitals outside Manipur. We have a postgraduate training institute here with postgraduate training in surgery. We are training surgery students who, after MBBS, come for DNB surgery. They train in surgery and they go back. People from outside the state are also coming for training here in surgery, medicine, anesthesia, and plastic surgery. These are 4 subjects we are giving postgraduate training here. Some of them return back, and when they go and find, they join some job over there, they find that the same thing that we are doing here for a particular charge, it is 2 to 3 times more.
Okay, so I got it. So the comparison of the cost is within Manipur, but in fact the cost is less in Shija compared to other treatment outside of India. I mean, no, sorry, outside of Manipur, within India.
I would like to go a little bit more deeper, explaining the cost. The cost borne by the government in treating a patient in a government hospital is not calculated. That is not taken into account. Let me explain. For example, there is a surgery unit 1. I wouldn't be knowing the exact details, but let us imagine. There's a surgery unit 1. They have their outpatient day on Monday. And the medical college system is that it is only on the day that they can admit their patient. So it is on Monday that they get admitted. And the surgery unit 1 has surgery day on Wednesday. Let us say it is not the same day as Monday. They will because they will be having OPD and emergency day, so they will not have surgery day. They will have the surgery day on Wednesday or Thursday, whichever. The patient gets admitted on Monday, gets operated on Wednesday. Patient is occupying that bed for 2 days or 3 days prior to surgery in that hospital before surgery. And after the operation, patient may get discharged next day or 2 days later. Again, that means they are occupying that many days.
1 week.
Who is bearing the cost of that patient occupying those beds for 2 days prior to surgery when it is not required? That is a system. So the government has to follow it. There's no way they can get out of it. But there's a cost to it. Somebody has to bear it. The government is bearing that bed. Otherwise, if the patient is admitted the same day, as we are doing here, operated the same day, and discharged the next day, the bed is vacant for the another patient. So number of beds would jump immediately if we change the system and then develop this thing. That is borne by the government, and the government is not able to increase the number of beds, although it is required. This is only one small example. Because of the system only, it is nobody's fault. It is the system that is there. So such costs are not counted by the people.
Because it is borne by the government.
Borne by the government.
Right.
Yeah.
So because people would only see what they have paid out of pocket.
Yes.
And here, because it's private, they pay everything out, so they just compare that.
Exactly. That is exactly right. So the cost to the community is not visible. Although it is costly, you cannot keep a bed, simply a bed in the hospital.
Right, somebody is paying, and you know it's from the tax money that goes to the government pays it, so that's what you're trying to say.
Exactly.
Yeah, the other point what I was trying to say is the people who are going out of Manipur, maybe it's the lack of trust factor, right, which we have discussed. So we have two things which we were discussing. One is the cost, and one is the lack of trust. And again, you know, with sharing and talking out, I think more people would have awareness. And because for me, like even though I'm staying outside of Manipur, knowing that, you know, we have a great hospital, like if my family falls sick and, you know, an ambulance can actually come and carry them.
Let that not happen.
No, but I feel little like safe and secure that yes, we have infrastructure there.
Monica, I'm finding the voices.
Finding the voices.
Finding the voice.
I could see my father. Who came to meet my headmaster because he was unable to pay the fee. I'm sorry.
Because we need such story for people to have faith in the government, in the system, that yes, it's working.
Let's bring peace in our home state, Manipur.
Who have got the job without bribery, they will do justice to their job, and they will help raise the standard of Manipur.
Me machine creado. I adu paraga tingogi.
Adivine, Paco.
You were asking about if I would like to add anything else. I would say that Manipur is in a very positive situation because of our geographical location. And we should realize that, and we should take advantage of it. And healthcare is something that we can do immediately many things about. So, for instance, to become healthcare tourism spot in Southeast Asia. It is possible. Manipur can do it.
Yes.
And there's an opportunity immediately. It is not like we have to start up a factory and then the production will be there and the production will we'll go and sell it to other countries. It's not that. The facility and infrastructure and human resources are already there. We have to realize it. All of us have to work together, capitalize it, and then use it as a method to increase our economic status and advantage, because it is there. Healthcare, we can do it. Our trained staff, nurses, technicians, surgeons, doctors, everything we have. And it is high time that we come together, realize this potential, and be prepared. Otherwise, we are going to miss big opportunity if we are not prepared now.
Right.
So all of us have to come together and get it done. Yeah. So we can have the entire Myanmar and beyond. We can cater to their healthcare needs here in Manipur, developing all the.
Yeah, I mean, even without the other things, we have already. I've been following the work of Caesar, and I have seen a lot of projects going on and clinics, and you guys visiting over there, going in the bus. So it looks like already, a lot of things are happening, and it will happen. So
it will happen. Definitely, it will happen.
Yes.
Yeah.
So to end our interview, I don't know how much you know about Finding the Voices, but just wanted to get your feedback and comments on Finding the Voices.
I am an ardent follower. I have followed so many of your productions, and I've seen it's really wonderful. I mean, today is a science time of IT, and that there are people who are knowledgeable in this sector, and then utilizing it to portray and to propagate goodness in our society in Manipur, not only to people in Manipur, to everybody else in the world. It's really wonderful, and I really appreciate the work you are doing, and it is really laudable. It's really good, and so many of the interviews inspired me. I don't remember, but there was one particular boy who was training for in the hotel
management. He was in UK. Yes.
UK.
Very young and vibrant.
I mean, just to watch him speak and then your interview with him, it really charges everybody.
Right. So I was sitting in Washington DC, and he was in
exactly.
UK.
Yeah, that interview. So it's. I mean, it's amazing, the work that you're doing. It's really good.
Yeah, thank you. No, I think it's more the participation of the guest speaker, like your voice, which is going to inspire our listeners. And then I believe that our voice is going to bring a change. Because right now, when I talk to particularly the young people, I see a lot of muddled mind who wants to do something good, but they don't know, like, what to do. So a lot of people in between, it's been a little bit of a struggle because I have a full-time job. I have 2 kids. So it's hard to balance, and sometimes you get critics, and I'm like, okay, I'm just gonna leave it. But I get very nice messages from our listener who has been influenced and impacted, and I think their voices and their message keeps me going.
No, you should continue. There's no way you can
yes,
stop.
because I feel that we have a lot of good things in our society, like all this initiative, which I would like the media to cover, but since they are not covering, I feel we should promote it and make it magnified, so that people will know that, oh, okay, there are these things happening. Otherwise, everybody is talking only about the conflict and other things.
Yes, very true. And in most of my awareness talks that I give about palliative care, I ask the people about one constant which is there other than death, and that is change. And at least we have in our capacity, in our ability to make the change for the better.
Right.
And the choices that we make will definitely make the changes for the better. So although we cannot avoid change, we cannot prevent change, we should at least make sure that we are moving towards the better change.
Right. And I think all of us are responsible. We cannot point that, oh, he or this organization has to do it.
Yeah.
We have to pitch in and do what we can, and only then can the whole society change.
True, very true. It is the world changes when I change. So we have to start basically from that concept. I have to change for the better, and definitely the world around me will change. I firmly believe that and practice it, and hope that we propagate it to others and they feel the same.
Yeah. Right. And yes, and Shija Hospital, I'm a great admirer of all the leaders here. I'm particularly thankful and impressed about being transparent and sharing updates, I think, which is very important. And then we also see initiative like the recent earthquake. You have provided free beds for the victims and such social cause, yes. Which again, like I said, I feel that we need to highlight all those, but most of the time we highlight, other things, which is why we are here for. So thank you for all the good initiative, and I'm looking forward for this palliative initiative, which I'll be following and
thank you very much.
Also be involved. So thank you so much for your time today.
Thank you for giving me this opportunity to speak with you and share my thoughts and feelings about everything. It's been really wonderful. We will have another conference in palliative care in 2017. The first one was called First Palicon, 2015. So we will have a second Palicon 2017 in most probably November of 2017. So I would invite all those people who are interested. Right. They can from now on be in touch, and then we will have a nice get together for palliative care in 2017 and with much more developments by that time.
Okay, yeah. Looking forward. Thank
you. Thank you so much.
Thank you.
Please tune in at Finding the Voices.